Hello friends, welcome back to my YouTube channel, that is ENT Chronicle, and the topic of discussion for today is nasal myiasis. So what exactly is this nasal myiasis? It's a presence of maggots in the nasal cavity. And what are maggots? Maggots are the larval form of flies. And these are the larval form of which fly? These are larval form of species known as Chrysomia byzania. So this is the species of the fly. This right here is the image of Chrysomia byzania and its larval form. Alright. So this Chrysomia byzania lays eggs. How many eggs does it lay at a time? It lays around 200 eggs at a time. And these 200 egg hatch within 24 hours leads to the formation of maggots. And is nasal myiasis climate specific? Yes. In India, the cases of nasal myiasis increases during August through October season. So therefore, it is climate specific. So what have we learned? Nasal myiasis is the presence of maggots in the nose, and maggots are the larval form of flies. And what species of fly? These are larval form of Chrysomia byzania. Chrysomia byzania lays eggs. How many eggs does it lay? It lays around 200 eggs, which hatch within 24 hours, leading to formation of maggots in the nose. And yes, nasal myiasis is climate specific. In India, increase in number of cases is seen around August through October. Now the question occurs, why are maggots dangerous in the nasal cavity? So maggots secrete tissue destroying enzymes within the nasal cavity, and thus these tissue destroying enzyme breaks the tissue, and the maggots eat everything that comes their way. So there is extensive necrosis in the nasal cavity and the adjacent structure because of this tissue secreting enzymes by the maggots. So I have attached the image of maggots in the nasal cavity. These right here are individual larval form of Chrysomia byzania in the nasal cavity. You guys could also see the extensive destruction that these larvae have caused in the nasal cavity. Now, there's a dictum which says that maggots are attracted to foul smelling discharge present in the nasal cavity. So, any cause which leads to the presence of foul smelling discharge in the nasal cavity will attract Chrysomia byzania, and Chrysomia byzania will lay hundreds and hundreds of eggs which will hatch within 24 hours. So, what are the conditions leading to foul smelling discharge? First, we have poor hygiene in the nasal cavity. Then we have atrophic rhinitis. In atrophic rhinitis, there is excessive crustaceans as well, along with foul smelling discharge. Then we have suppurative sinusitis as a cause of foul smelling discharge. And next are sinus malignancy, immunocompromised states, and granulomatous disease of the nose. So in all these conditions, there is presence of foul smelling discharge, which attracts the fly, that is right here, Chrysomia byzania, which lays around 200 eggs which hatch within 24 hours, leading to formation of maggots, and maggots further eat the tissue. Now let's discuss about the signs and symptoms of nasal myiasis. So since it's an organic foreign body, there would be foreign body sensation as symptom. There's going to be irritation and tickling and crawling sensation within the nasal cavity. And the point to be remembered here is these symptoms are present in initial 2 to 4 days of infection by the larval form of Byzania species. After that, the symptoms are very destructive. As soon as the larval form starts to eat tissue, there's gonna be epistaxis, the characteristic diffuse swelling around nose and eyes, and of course, since the maggots are eating the tissue, there is going to be pain around the nose. And finally, we might always see nasal obstruction as well. So symptoms, initial symptoms include foreign body sensation, irritation and tickling, crawling sensation because of the maggots, which are limited to initial 2 to 4 days of the infection. After that, there is extensive destruction of tissue, leading to epistaxis, characteristic diffuse swelling around nose and eyes, and pain around the nose, and nasal obstruction is seen as well. Now, signs are discovery of maggots in the nasal cavity. Foul smelling discharge is going to be there because there is extensive destruction of tissue and necrotic tissue is also present. There is going to be ulceration in nasal mucosa, and these two are the late stage complications as well, that is septal perforation and nasal bone destruction because of the maggots. So signs include discovery of maggots, necrotic tissue, foul smelling discharge, ulceration, and these two are end stage complications, that is septal perforation and nasal bone destruction. Now let's discuss about the complication and cause of death in the patient of nasal myiasis. So the complications include septal perforation along with palatal perforations. We might as well see osteomyelitis in the patient of nasal myiasis. We also see sepsis, and finally we also see meningitis. So the complication include septal perforation, palatal perforation, osteomyelitis, sepsis, and meningitis. Now, what are the causes of death in the patient of nasal myiasis? First, we have meningitis. Then we have sepsis in the patient. And finally, due to psychosocial or psychological disorder, the patients of nasal myiasis typically commits suicide. So it also becomes a cause of death. So what is the treatment and management of nasal myiasis? So the definitive treatment of nasal myiasis is manual removal of maggots after applying the cat oil. Now what is this cat oil? Cat oil is nothing but the mixture of chloroform, 25% of chloroform to be specific, and turpentine oil in the ratio of 4:1. So we apply this cat oil into the nasal cavity, and the maggots are removed manually by the means of forceps or by the means of douching. Nowadays, turpentine oil is preferred applicant for manual removal of maggots because chloroform has various side effects in the human body. Along with turpentine oil, we might as well use potassium permanganate nowadays. So is there any need for surgical intervention in patients of nasal myiasis? Yes. We use surgical intervention to remove any necrosed tissue in the nasal cavity or the adjacent structure, and if possible, reconstruction of the damaged tissue. So what other management do? We advise the patient for keeping good nourishment of his body. Multivitamin he has to take 1 tablet daily for around 2 months. And his anemia has to be management. Anemia happens because of excessive epistaxis due to tissue destruction. Tetanus toxoid 1 ampule intramuscular is given to the patient. Antibiotics, injectable antibiotics are given to prevent secondary infections. NSAIDs to relieve pain, 500 mg acetaminophen is given thrice daily. So this was the treatment management of nasal myiasis. If you like the video, please like and share my channel, and please do subscribe.